Wear personal protective equipment. Provide client privacy. Regulate the room temperature to 25 up to 28 degrees Celsius to prevent maternal and neonatal hypothermia. Assemble the necessary equipment. 2 pairs of sterile gloves, antiseptic solution, cotton pad, kidney basin, cord clamp, curved forceps, may use scissors, tissue forceps with teeth and needle holder, 2 sterile cloths, baby's bonnet, 1 tuberculin syringe, and 1 piece of 3 ml syringe.
Hello, I am Hannah Gando, your nurse for today. For verification purposes, could you please state your full name and date of birth?
I am Mrs. Madeline John, born on November 15, 1997.
Mrs. John, I will be assisting you before, during, and after the delivery of your baby.
Yes?
But first, can I assist you to be on lithotomy position?
It's fine.
Okay. Are you comfortable in that position?
Yes.
In preparation for the delivery, I will first perform perineal flushing.
Is that okay with you? Yes.
I will now expose your perineal area and clean it. Wipe the perineal area with a cotton soaked in antiseptic solution from front to back. Then discard. Then use another cotton soaked in antiseptic solution to wipe the labia minora from front to back. Then discard. Then use another one for the other side. Then discard. Wipe the labia majora from front to back. Then discard. Then use another one for the other side. Then discard. After perineal flushing, I will discard all the items used in the procedure and doff off my gloves. I will now observe for the signs of second stage of labor or the expulsion stage. Crowning is present. Mrs. John, I can see now the top of the head of your baby, so we will now start the normal spontaneous delivery of the baby. Mrs. John, please do a deep slow breath and push, okay? 1, 2, 3, and push. 1, 2, and 3, and push. 1, 2, 3, and push. Using the Regent's maneuver, I will assist the delivery of the baby's head. When the vaginal introitus opens to a diameter of 5 cm or more, I will place a sterile towel using my dominant hand and apply a gentle upward pressure on the baby's chin. While I place my other hand to the suboccipital region of the fetal head, held against the mother's symphysis pubis to help the fetus achieve extension and head to be born with the smallest diameter of the presenting part and prevent perineal lacerations. After the head is delivered, I will observe for the external rotation, wherein the baby's face is facing the mother's thigh. When the baby is in external rotation, I will apply a gentle downward pull to assist the descent of the anterior shoulder. I will pass my finger to the fetal neck to determine if a nuchal cord or a cord coil is present. There is no nuchal cord, so I will now apply a gentle upward pull to deliver the posterior shoulder. After both shoulders are delivered, the baby's trunk and lower extremities will be delivered promptly. I will place the baby at or below the vaginal introitus for 3 minutes so that the fetal-placental circulation will not be compromised by clamping the cord. Baby girl out, 12:55 a.m., December 1, 2021. Congratulations, Mrs. John! I will now place the baby on mother's abdomen in a prone position with the head lying on one side to allow secretions to drain from the nose and mouth. Then, with a sterile cloth, I will immediately and thoroughly dry the baby.
Mrs. John, I will put a bonnet on your baby's head to keep her warm and avoid hypothermia.
Clamp and cut the umbilical cord. First, I will feel for the cord pulsations. When it stops, I will clamp the cord 2 centimeters or 2 finger breadths from the base. And clamp it again at 5 centimeters from the base. Then, cut 1 centimeter from the cord clamp located near the baby's umbilicus. I will observe for the signs of placental separation, which occurs 1 to 5 minutes after the delivery of the baby. These signs include globular and firmer uterus, lengthening of the umbilical cord, and the sudden gush of blood from the vagina. I will gently palpate the mother's abdomen to feel if uterus is contracted, and to watch out for uterine atony or relaxation, which requires immediate intervention. I can also observe the lengthening of the umbilical cord and the sudden gush of blood from the vagina. I will now deliver the placenta carefully without forcing it. I will rotate the placenta slowly to prevent it from being ripped and retained in the birth canal. After the placenta is delivered, I will assess the completeness of the cotyledons. The cotyledons are complete. I will set aside the placenta and handle it according to the institution's policy. After placental delivery, I will clean the vulva with an antiseptic solution and check if there is a presence of perineal lacerations. Wipe the vulva with a cotton soaked in antiseptic solution from front to back. Then discard. Use another one and wipe again from front to back and discard. Wipe the other side from front to back, then discard. Wipe again from front to back, then discard. Then again, wipe from front to back, then discard. There is no perineal lacerations observed during perineal flushing. I will now set aside the items used in perineal flushing. Mrs. John, since there is no presence of any perineal lacerations, I will now apply a perineal pad on your perineal area. Then, I will drape you. Place the mother in a comfortable position. Mrs. John, are you comfortable on your position?
Yes.
Okay. I will check the mother's vital signs to assess how well the client tolerated the normal spontaneous delivery. Mrs. John, I will take your vital signs to assess how well you tolerated the normal delivery of your baby. Is that okay with you?
Yes.
Okay. I will first assess your blood pressure. Okay. Your blood pressure is normal. We will now proceed to your temperature. Okay. Your temperature is normal. Then your pulse. Your pulse rate and respiratory rate is also normal. Your blood pressure, temperature, pulse, and respiratory rate are all normal. You tolerated well the normal delivery of your baby. Then, I will administer vitamin A intramuscularly. After the procedure is done, the client will now be transferred to the ward. Then, record the procedures and findings. Mrs. Madeline John, born on November 15, 1997, undergo normal spontaneous delivery, gave birth to baby girl, 12:55 a.m., December 1, 2021. No perineal lacerations. BPTPR normal after delivery. Vitamin A administered intramuscularly. Nurse's signature.